Okay, good day. Good day, everyone. So, how are you? No, today we're going to have a review, no, sa katong mga ano na to, mga na-discuss na to na mga topics, no, such as kining yung topic na to sa diseases affecting the sense organs, diseases and injuries affecting the bones and muscles, no, diseases affecting the stomach and intestine. So we have discussed this one, no, last meeting. So I know you're very familiar to this topic. So let's start reviewing to this topic. No? So let's start. Okay, so okay, no, mga key points lang ang ato ang gibutang, no. This is affecting the sense organs. So this is was the topic, no. So if you want the full details of this one, no, you could watch the videos. Okay, diseases affecting the sense organs, no. So these are some of the diseases that may affect our sense organs, no. We have the conjunctivitis. It's the swelling and redness of the conjunctiva, no. So kung magpula-pula ang imuhang diri ano sa imuhang eyes, no. So a cataract is a clouding of the lens of the eye, no. So kanang mag clouds na yung mata, na mga puti-puti, commonly ang maigo ani katong mga elderly persons, no, to mga lola na to. Then a common ear disease for children is the otitis media. No, it is a painful infection that causes swelling of a portion of the middle ear. No, so the tinnitus can be described as the unusual ringing in the ears, sounds like the roaring, clicking, hissing, or buzzing can be heard by the person affected by this disorder. So, if you are suffering a tinnitus, so these are the things that you may suffer. Okay, so mag-roaring, mag-clicking, hissing, no, buzzing, and then also cold. No, cold is an infection caused by virus, no, which affects the nose and throat. No, kanang magka-cold ta, no? So it is an infection caused by a virus. So you may drink mga biogesic or paracetamol, no, to relieve ang body. No, tongue is the strongest muscle in the body. However, if not taken care properly, it may be infected and acquire some diseases. No, the most common disease for tongue is sores or tongue blisters. So like that one, no. So na mga burot-burot sa tuang tongue. No, that's what we call the tongue blisters. So that's the common disease that our tongue may encounter or may suffer. And next, no, common skin injuries are scratches, lacerations, and bruises. No, so those are the common skin injuries to our that our skin may suffer. Okay, next, no. So let's proceed to the question and answer portion. No, this can be described as the unusual ringing in the ear. So tawag dyan, no, tinnitus. No, this can be described as the unusual ringing in the ears, no, nga na mag clicking, roaring, no. Now, this kind of disease is a result of abnormal growth of cells on the skin, epidermis. So, tawag na to ano niya, skin cancer. So, if you have an skin cancer, so there will be an abnormal growth of cells sa imong skin, no? Skin cancer, no, this kind of disease is a result of abnormal growth of cells on the skin's epidermis, no? This often caused by too much exposure to radiation, no, coming from the sun or strong light sources. So these are wounds that go through the skin. No, this is often caused by sharp objects. So ang tawag na to ano na mga cuts or lacerations. No, these are wounds that go through the skin. No, this is often caused by sharp objects. No, for example, sharpener and kining gunting or any sharp objects. No, kanang naghiwa. For example, maghiwa ka og kamatis, no, you're using a knife, then ang knife grabe ka kahait, then accidentally imuhang nag na nasama nimo ang imuhang kaugalingon, no, nasama nimo imong kamot. So those are example of cuts. Next, no, what is the most common disease for tank? No, ang common disease sa tong tank no mo na sa tank blister. So we have know that a tank is the strongest muscle in the body, and then the most common disease for the tank is the sores or tank blisters. Okay, these are also given to a person with otitis media to lessen the earache. So yung tawag doon, no, pain relievers. So the most common treatment for otitis media is by taking antibiotics in the form of ear drops. Pain relievers are also given to a person with otitis media to lessen the earache. So but before you kanang mga pain relievers, no, you ask the mga health expert, no, kung unsa nga pain reliever. Okay, it is the painful infection that cause swelling of a portion of the middle ear, no? So painful infection, no, that the otitis media, no? So ear, no, look at, no. It is a painful infection that cause swelling of a portion of the middle ear. Okay, next tayo, an infection caused by virus, no, which affects the nose and throat, no. So caused by virus, so cold, no. So this is common, no. I experienced it one, and maybe siguro kamo naka-experience mo cold, no, kanang magka fever, magka sore throat, no. So mo na siya ang kuno virus ang dahilan pod, ana virus ang cause. It is the swelling and redness of the conjunctiva, a thin layer of tissue over the sclera and the inside of the eyelid. So tawagan na niya conjunctivitis. Oh. So no swelling. No, it is a swelling and redness of the conjunctiva, a thin layer of tissue over the sclera and the inside of the eyelid. No, so this may cause this is may be caused by bacteria, virus, or harmful chemicals from the shampoo. The next, if you have a conjunctivitis, what is the best thing to do? So what is the best thing to do pag nakay conjunctivitis? So of course, you have to visit a doctor to determine first its cause. So to treat conjunctivitis, visit a doctor to determine first its cause, no. So you have to consult a doctor, no. So if the pink eye is caused by bacteria, put antibiotics, but because expert will advise us, no, on what to do, no, kung unsay buhaton nimo ana, unsa na mga antibiotics ang ibutang, no. A clouding of the lens of the eye. This makes people with cataract see through their cloudy lenses like a fog up window. So tawag na niya cataract, no. So cataract, no. So kanang mag gamog-gamog bitaw ang mata. So mostly sa mga elderly uh, people, no. So we're done with the first first na to na review. So let's continue to the diseases and injuries affecting the bones and muscles. So let's proceed now. Okay. Okay, wait lang ha. Okay, diseases and injuries affecting the bones and muscles. So we have learned the diseases and injuries that that our bones and muscles might encounter, no, or may suffer. Okay, so key points na lang akong gibutang diri ah. So key points of fracture is a break in the bone. It happens when a bone is subjected to strong force which causes it to break, no, karang imong bukog mabali, no. So magka-fractured, no, because there are a lot of cause nganong magka-fractured ka. Pwede nabunal ka, or pwede nabanggaan ka, or no, depende. Not all accidents may lead to the breaking of the bone, no. Some injuries may lead to bone dislocation or the moving out of the bone from its position in the joints, no. Ma-dislocate, no. Ma-dislocate ang ang forma or ang kuan sa bones, no. So a sprain is an injury to the ligament when it is stretched or turn, no. So mo na siyang ang sprain, no. So injury to the ligament, no. Ang osteoporosis is a bone disease that is very common to elderly people, no. It is the thinning and weakening of the bones which can result to painful fractures. So mostly ang maigo ning osteoporosis kining mga old persons, no, kaning mga lolo, lola, no, dito sa labi na dito sa likod nila, no. So may mga deformities. And then next, no, arthritis, no, is another sickness common for elderly. It is the swelling of the joints which may cause pain, stiffness, and reduce ability to move, no? So ang arthritis, no, mostly po sa mga tigulang po, no, mostly, no, ang maigo sa ila, no, so magkakaroon sila og swelling of the joints, no, then sakit, no, and then magkakaroon sila og ma-reduce ang ilang ability sa ilang paglihok. Rickets is a bone condition that is usually observed in children. It is a condition brought by lack of calcium and vitamin D. So it means, no, if you're lack in vitamin D, probably calcium and vitamin D, probably pwede ka maigo aning rickets, no. Next, dito tayo sa strain, no. Strain on the other hand is a tear in the muscle or the tendon. Cramp is a sudden involuntary contractions of muscles that do not relax, no. Kung magka-cramp ka, kinahanglan i-massage nimo tong area kung asa ang nagka-cramp, no. So mostly sa mga athletes, no, magka-cramp sila. Labi na kung ang physical activity is grabe ka intense, then dili na sila kapahuway, no, dili kapahuway ang muscles. So muscular dystrophy is an example of hereditary disease, which means it may be passed from one generation to another, no. Kining muscular dystrophy, hereditary, it means, no, from your sa imo pang lolo, from your grandfather pa, no, mapasa dito sa mga next generations, no, sa mga kaliwat ana. So but still there are ways, no, to avoid this hereditary disease, no. So poliomyelitis or polio is an infection caused by poliovirus. No, this disease attacks the spinal cord cells, which can cause leg deformities or even paralysis. No, today our government, no, they're doing a program, no, to end polio, no, para to mga bata pag anak nila they're normal, no, dili maigo sa polio, and then also to avoid uh, them, no, sa polio, no, sa kanang mga deformities sa ilang lawas. Okay, so next we have now the question and answer, no. It is a break in the bone. So fracture is a break in the bone, no. So a bone disease that is very common to elderly people. So a bone disease that is very common to elderly people, no, itong osteoporosis, no. A bone disease that is very common to elderly people, no. So nay advertisement ana nga gatas ka para malikayan ang osteoporosis kanang anlin ba na? A sudden involuntary contraction of muscles that do not relax. So cramp, no, cramp is a sudden involuntary contractions of muscles that do not relax. No, this is a very painful muscle but lasts only for a few minutes, no. So when I experience cramp, so nagtagal sa mga 5 minutes. So pinakataas na kay ng 5 minutes, no. So that's because of ang kinahanglan ang ato aging mga muscles before we engage sa physical activities, no, kinahanglan sa nato magkuhan sa stretching. Okay, then it is a condition brought by lack of calcium and vitamin D. So the answer is rickets, no, a bone condition that is usually observed in children, no. It is a condition brought by lack of calcium and vitamin D. Okay, an injury to the ligament when it is stretched or torn, no. So sprain, no. So mo na siyang sprain, no. So kana siya, no. So it is the swelling of the joints which may cause pain, stiffness, and reduced ability to move, no, labi na sa mga katigulangan ang arthritis, no. So another sickness common for elderly, no. So swelling of the joints which may cause pain, stiffness, and reduced ability to move. Okay, it is the thinning and weakening of the bones which can result to painful fractures, ang osteoporosis, no. So sa mga katigulangan, no, so sa mga kanabitang magkaidaran na ang magka-weak ang kuan sa mga magkatigulang, no, labi na kung abot na sa mga 50 pataas, no. So sa 50 strong pa, pero padulong na diha bang kuan ba ang bones ba burag kaanam-anam nag-weak, no, due to age na pod, no. Then sometimes, no, kining mga kining mga elderly na nato, mga kanang senior citizen na dili na kayo sila maka-endure no sa mga physical activities. Next no, a bone condition that is usually observed in children. So tawag na nato rickets no. So a bone condition that is usually observed in children. Okay, it is an example of a hereditary disease which means it may be passed from one generation to another. Tawag na to ana muscular dystrophy. Okay, so an example of hereditary disease which means it may be passed from one generation to another. Okay. So this is a very painful muscle condition that lasts only for few minutes. So cramp, no? So ang cramp a very painful muscle condition but lasts only for a few minutes. No, again, no, to avoid a cramp, no, before doing physical activity sa buntag, no. So i-stretch na ninyo for at least 10 minutes or 5 minutes ang inyong mga muscles, no. Okay, so we're done with the diseases no sa atuang sa atuang sa atuang um, bones and muscles no to the last topic. So ang last topic. So for the full details kung gusto niyo naman ko ng full details, so just I na dito sa mga videos no mga videos na to no makita na dito sa videos no sa so just a comment no so ako lang just comment no sa kung para sa link katong mga videos na to ang ginakuan. Okay, so continue ta. Okay, here no. So this is affecting the stomach and intestines. So hyperacidity is a result of having too much acid in the stomach. No, acid in the stomach is necessary to kill the bacteria in the food you have eaten, but too much acid in the stomach may cause its a wall lining to have wounds and result to ulcer. So kung sobra ra ang acid sa sa atong stomach, it's not good food. No, dili pud na siya maayo. Next, no, diarrhea. Okay, and diarrhea is the frequent movement of loose and watery bowel stools. No, this is often caused by eating contaminated food, which is prone to having bacteria. So we have to avoid eating contaminated food. No, for example, me siguro no sa ako alang no, kana bitaw mga tusok-tusok bitaw sa mga ginabaligi. I'm not wala na ko wala na ko gikuan pero lami man gid na pud na siya no. Pero we should be very careful no kay basin og may mga kuan diha ang uban no. Ang we don't know. So that's why para to avoid diarrhea we have to very very careful ta sa mga kauno nato na mga pagkauno sa atong mga panimalay kung panos na dili na siya kauno no. So gastroenteritis, so also known as stomach flu, is a severe kind of diarrhea. The opposite of diarrhea is constipation. This condition is the irregular or infrequent bowel movement that are hard to pass no kana maglisod ka og pagawas no. So unsay pagawas no maglisod ka pagawas sa atuang hugaw no. Next, no, when you say you have an upset stomach, it means that you are having indigestion or dyspepsia. Okay, appendicitis is the inflammation of appendix, no, a small tube that extends from the large intestine. No, the colon cancer is the cancer of the large intestine, no, which is the final part of your digestive tract. Okay, so let's proceed now. No, a result of having too much acid in the stomach, that what we call the hyperacidity. Okay, so pag sobrang acid sa tuang stomach, so magkakuan tawag hyperacidity. Okay, the frequent movement of loose and watery bowel, no, or stool, so diarrhea, no. So that's what we call diarrhea, no. So kanang okay, sorry. Okay, this is also known as stomach flu, no? It's a severe kind of diarrhea. So, ang tawag na tong gastroenteritis. So what is the opposite of diarrhea? So unsa may opposite sa uh, unsay no unsay opposite. What is the opposite of diarrhea? So unsa tong opposite sa diarrhea? Okay. So what is the opposite of diarrhea? So the opposite of diarrhea is constipation, no? So what is the cause of having a diarrhea? So here no eating a contaminated food, no, which is prone to having bacteria. So that's why we have to avoid eating itong mga pagkaon nga contaminated, no, labi na itong mga panos-panos. Then again, no, kanang mga tuhog-tuhog, no, so kinahanglan careful ta na kung pwede malikayan siya. Of course, no, lami man gid pud lami man gid sa mga kuan gid, no, kanang mga isaw nga ginabaligya dia, but we should be mindful na, of course, no, so kung magkakuan, no, which of the following is the best thing to do to avoid dehydration when one has diarrhea? To avoid dehydration, you have to drink plenty of water. No, so this condition, if left untreated, may result to dehydration or loss of too much water in the body. No, so to treat this drink of plenty of water to replenish the body. So pag natay dehydration, we have to we have to drink water, no, drink plenty of water, no. It is the inflammation of appendix, no, a small tube that extends from the large intestine. So appendicitis, no, so the inflammation of our appendix, no, small tube, no, nga naka-extend dito sa tuwang large intestine, no. This condition is the irregular or infrequent bowel movement that are hard to pass. So constipation, no. So ang constipation, no, irregular or infrequent bowel movement that are hard to pass, no. So kanang dapat everyday daw, no, ang everyday natay mapagawas, no, and then dili ta lisod magpagawas sa to ang mga hugaw, no. What is the most effective way to improve digestion? No, to improve digestion, we have to hydrate. No, you have to hydrate your body with enough water, no. Kung natay one of the most effective way, no, to improve digestion, no. So dili po nang mukaon kag mga eat hard food, no, kay lisod man na siya matunaw dito, no. So eat more liquid and meat, so likayan gapon, no. So ang meat, likayan gapon ni siya kay lisod pud ni siya tunawon po dito sa ato dito, no. Which organ is affected when someone has hyperacidity? No, kung natay hyperacidity, so unsa man nga organ ang maapektuhan gid ani? So of course, no, ato ang stomach. Okay? So thanks for watching, and thanks for joining in this live session. So God bless. So hoping you learn from this sa atong review karon. God bless everyone.